What does the latest research show when it comes to cell phones and possible radiation exposure? Joining us this morning is UC San Diego neurosurgeon Dr. Chen. Doctor, good morning.
Good morning.
Thanks for joining us. You know, we were talking right before we came on about the fact that we've heard so much about this in the last 10, 15 years, but these latest studies, are we learning something new in the last couple of years that we didn't know before?
Right, we're beginning to have long-term information about what happens when you use cell phones. There were some controversial studies in the earlier days that suggest that if you are a heavy cell phone user over a span of 5 to 10 years, you may be at increased risks for developing cancers of the head and neck. Now, what we have now is long-term data. You know, the use of cell phones really skyrocketed between the 1990s and the 2000s. It went from something like 4 million users to about almost about 300 million users, so
wow.
30-fold increase.
Wow.
If there were really a significant risk associated with cell phone use, we should have seen an increase in the number of cancers. And the most recent data suggests that we really haven't seen that, suggesting that if there is a risk associated with cell phone use, the risk would be a very small one.
Okay, which is good news.
Absolutely.
Okay,
absolutely.
So let's talk about, well, we're talking about the phones with the highest and the lowest radiation rates, according to the FCC, of course. Let's talk about this specific absorption rate. What is that, and how do you measure that in the phones? Explain it to the folks at home.
Well, most of these things are done using models and calculations, and so these are extrapolation numbers. That said, you know, each manufacturer actually comes out with specific recommendations as to how close you can hold your cell phone to your face. For example, if you read the fine prints of an iPhone, it says that you shouldn't hold the phone any closer than about 5/8 of an inch to your face.
Okay.
For BlackBerry, it's about an inch, and those numbers reflect the type of or the amount of radiation that they're thought to produce.
The newer iPhones, we're told, has an SAR between 1.1 and 1.2. So is that, when you say that close to your face, you mean you shouldn't put the phone directly onto your ear? Or how does that
that's
work?
what the manufacturers recommend.
That's unusual because most people do if they're not using a Bluetooth.
Absolutely. And so, you know, what we recommend for folks is whenever you can use a speakerphone, use a speakerphone. Right. So the amount of radiation received really is proportional to how close you are to the source. And so when you could use a speakerphone, use a speakerphone. If you could use an earbud, use an earbud.
Okay, so what about Bluetooth? Because a lot of folks have concerns there too, because there's still some sort of waves going from your phone to the Bluetooth. Should we be concerned at all about that?
Of course, the Bluetooth radio frequency waves are a little bit weaker. The problem is people forget that they're using their Bluetooth. So they put their phones close to their bodies, next to their bed. And so as long as you're aware of the fact and you're cognizant of where your cell phone is relative to your body, relative to the time that you're using it, it's going to be fine.
So that's been a concern over the years about people who sleep with their phones right next to them and perhaps even next to them on the pillow.
Right.
So would you recommend people not do that just to be on the safe side? Or?
I think so. I think that, you know, again, the data linking cell phone to tumor is weak, but just to be on the safe side, you want to do everything you can to minimize it.
The thing with the phones now, they do so much.
Yes.
So would you say texting, not while driving, but is texting better than calling in terms of the actual functionality of the phone and the radiation that it emits?
That, based upon what we just talked about, that's absolutely right. Again, when you're texting, you're keeping the phone at a certain distance from your face. And so what that means is that the source of the radiation is farther away, so the amount of radiation that gets to you is smaller.
So maybe all the kids out there were on the right path this whole time by loving the texting and everything else. And so it's so much still to learn. This technology in the grand picture is still fairly new.
That's right.
In the amount of time we use it. Doctor, thank you so much. By the way, if you want to check out your phone's radiation levels, you can visit fox5sandiego.com and click the Scene On tab. Dr. Chen, we thank you for your insight. Keep up the good work.